I'm thrilled to be in the studio today with a very special guest, Chuck Strand, Executive Director of Rural Minds. And I didn't know much about this, I'm going to say service and mission, really. I look at it as a mission that is available. And I really look forward to talking to their Executive Director, Chuck, today about that. And you're going to learn today from Chuck about some of the barriers, challenges, and concerns regarding access to healthcare and so much more. And so, Chuck, before we get started with the meat and potatoes of our questions, let's talk a little bit about your role at Rural Minds. How long have you been there? What brought you to the organization? And the greater question is: there's a lot of things to do in this world. Why in the world did you choose
hmm
this?
Well, yes. Hello, JJ, and it's great to be here. Thank you for having me. My name is Chuck Strand, Executive Director of Rural Minds. The organization is the only national 501(c)(3) nonprofit that's focused on providing free information and resources to confront the rural mental health challenges and the stigma surrounding mental illness. So we advocate for the mental health equity in rural communities, promote mental wellness, and distribute educational content. We serve 46 million people living in agricultural communities, small towns, isolated areas across rural America. So I've been with the organization from the beginning, and we're coming up on our fifth anniversary in October. And I was
Wow.
here to help get everything started and kind of tapped into my experience in the nonprofit space. I was with the prostate cancer nonprofit for 10 years prior to Rural Minds,
Oh,
and I led
wow.
that organization for the last four. And early in my career, I was with marketing, communications, promotions agencies doing consumer packaged goods work. And I really, as far as response to why I chose this field, I really wanted to do something that had a personal connection to what I care about most. And so I got into patient advocacy. And when I was in the prostate cancer space, I we did some work with mental health in terms of the impact that side effects for treatment might have on some people. And I really, became more interested in mental health, and it really brought me to the realization that for me personally, I think that mental health is really the foundation for overall health. So when this opportunity came around to connect with the founder of the organization, Jeff Winton, I was very excited about partnering with him, and we've got an awesome team of people that are all focused on the same goal, which is just to really improve mental health in rural communities and address the unique challenges that are specific to folks who live in rural America.
Shared with our producer that having read your bio and a little bit about the work that you're doing, this is mission minded work. I mean, it's certainly a need in our communities. I'll talk a little bit here in just a few minutes about the need in rural Hillsdale County in how services like you offer could impact positively our community members. But before we get into all of that, we like to humanize our guest a little bit with our listener. Maybe a fun fact about yourself, something interesting that you can share with our listeners to help relate, that you are a true
Yeah.
person and not just all work.
Mhm. Yeah. Well, my wife and I have raised our family in the Chicago metro area, but I grew up in a very small town in Upper Michigan near the shores of Lake Superior, Ironwood. And so I spent a lot of
Oh
time
my
outdoors
goodness.
year round in the North Woods. And we still have a family cabin on the shores of Lake Superior. Over the years, I've done a lot of kayaking around the Apostle Islands, which I really enjoy. And
Oh, yes.
making the best of what I've got available in Chicago. Throughout the winter, I've for the past couple winters, I've kayaked with some friends on the Chicago River, and during the summer, I am
Wow.
sculling in Lincoln Park Lagoon between the Lincoln Park Zoo and Lake Michigan. So I'm trying to take advantage of the outdoor opportunities that don't exist everywhere, but I do definitely like to get back up into the North Woods as soon as much as possible.
Yeah, Ironwood. My goodness, I've been
Yeah,
there.
a lot of skiing and
I've
yeah,
been to, oh
yeah,
yeah, Iron County
yeah.
and Iron Mountain and all of those
Yes.
things. My goodness. Well, I didn't even know you were a Michigander, so that's great to
Yeah.
know. That's a fun
Yes, it
fact,
is.
given this is a Michigan-based podcast. Well, as I said earlier, Chuck, it's great to have you on the podcast. We're going to jump into some things here in just a minute. And for our listeners who just tuned in, today we're talking about mental health care and the access in rural communities to mental health care. Chuck is here to provide information on the state of mental health care in our nation right now, issues in the care model and delivery of it for mental health, and its impact on our communities, specifically as we look at rural. We'll talk about stigma, barriers to care, and of course, what all this has to do with rural health. So, first of all, let's start in our discussion about How did Rural Minds start? And let's talk about the global picture of its mission.
Well, the organization was founded by Jeff Winton, and it was in response to the family tragedy that was experienced with the death by suicide of Jeff's nephew Brooks. At the time,
Mm,
Brooks was
mm,
28 years old and left behind 3-year-old twins, and
oh,
the family had a dairy farm, and then still Jeff still is on a dairy farm in upstate New York. So when Brooks passed away, many people in the local community, small farming area, just assumed that they might make something up about the cause of death for Brooks. And Jeff and his family and his mother especially really was adamant about wanting to tell the truth and break down some of the stigma, because the similar things that happened to other people over the years in terms of how people dealt with death by suicide in rural communities, and they really wanted to make a difference. So Jeff delivered the eulogy at Brooks' funeral, and after the ceremony, a lot of people came up to him and they talked about their own challenges and something
mm,
that might have happened in their family or in their community, and it really made Jeff realize that there was a real need for um, mental health conversations in rural communities. And so he made the decision at that time to want to do something a little bit later, though, because the twins, Brooks' son and daughter, were only 3. So Jeff and his
wow.
family waited until the twins were in their teens before they launched the program and the organization. So that's really the story behind Rural Minds. And before Jeff launched Rural Minds, he also talked to many of the existing nonprofits that are in this space, mental health space, including NAMI, Mental Health America, Depression Bipolar Support Alliance, and they have great information that's available to anybody anywhere. But for whatever reason, the um, the the statistics in rural America in terms of the mental health challenges and the fact that people in rural communities are overall 49% more likely to die by suicide than folks in urban areas,
Mm,
something is missing,
mm,
something is not connecting. And the larger organizations that Jeff spoke to really welcomed the opportunity for Rural Minds to kind of supplement what they are doing overall, but realizing that it's different in rural. We really are kind of feel a very needed and important niche within the mental health space, because with the barriers that we'll talk about a little bit later, in addition to the higher statistics for mental health incidents, is just really underscores the need for what we're doing. So we're growing quickly, and there's
mm.
a it's all due to the great partnerships we have on many fronts, and many people and many organizations that are sharing our mission and the work that we do. So we're grateful for that. But it's good to know we're able to do things that are needed, and we always reach out to find out what is needed, because we don't ever produce
Hmm.
something that we think people need or want. We do a lot of
Right.
listening and connect with people on the ground in rural communities to understand what they need, what's missing, how to make it culturally relevant, and then partnering with people that are in rural America to deliver the information.
Yeah, and I would assume that there's some similarities, obviously, as you meet with these community members. One of the similarities will be the aspect of barriers, and barriers in rural communities. I'm sure are consistent from rural community to rural community, taking away the conversation initially about the stigma. Let's talk about barriers
Mhm.
to mental health access and wellness programs in rural communities. So, if you could tell us, what in your experience, having spent now 5 years working in this environment, what are the most significant barriers for our patients who need mental health
Mhm.
in rural communities?
Well, unfortunately, there are many, and they kind of fall into two categories. There are the barriers that are more inherent in geographic and technological aspects, and then there are also lifestyle barriers. But from top of the list, there's a severe shortage of healthcare providers overall, especially mental health professionals in rural communities. and people have difficulty getting an appointment with the limited availability
Yes.
of these mental health professionals, and they're often further away. So it takes more time to drive longer distances, and like we know, many rural areas and communities don't have public transportation. There's no ride share like
Correct.
Uber or Lyft, and many small areas don't even have a taxi service. There's also the unreliable, expensive, and sometimes non-existent internet service. 30% of
Oh yeah.
households in rural America don't have internet, which of course makes
Right.
it impossible to do online virtual appointments or telehealth appointments. And there's often a lack of health insurance coverage due in part to the weakening
Correct.
agricultural economy and financial instability. So those are kind of like the structural, so to speak, barriers, but there are also barriers to mental health care that are inherent in a rural lifestyle. And really the biggest barrier is the stigma that surrounds mental illness in rural America. There's this self-imposed, perception of that asking for help is, you should solve your own problems, and self-reliance is a virtue, but that is counter to what's needed for getting help many times with a mental health situation. So, but people, yeah, because of that stigma, they're afraid of being judged negatively from others as being incompetent or less capable. There's also can be a lack of trust in anyone maintaining confidentiality in a small, close knit community. And
Hmm.
oftentimes people just feel isolated without having access to talk with someone outside of their community who really understands what it is to have a mental health challenge in a rural community. And finally, that any segment of the population that you can think of that would be in major metropolitan areas, those folks are still in rural communities. They just might feel more isolated and more alone, and so there are greater barriers around race, class, disability, sexual orientation, and gender identity.
So let me go
Mhm.
back because I'm interested in, we talk about some of those barriers, and you talk about transportation, for example, but let's talk a little bit about some of the solutions to that, because what would you offer a community that's listening today that says, Chuck, that's my community.
Mhm.
Okay, so we don't have transportation. Now what do we do?
Mhm.
I mean, what advice or suggestions based on, your what you've reviewed in the models exists for rural communities that have no public transportation to get patients out? What would you recommend to their leadership, their CEOs? How could they get these services there?
As far as um, the solution, really, I think, is not so much that in and of itself transportation is the barrier, but the fact that the stigma is so great that people don't feel
Right.
comfortable asking for a ride or
Locally.
having their car being
Yes.
gone. If you
Yeah.
only have one car in the family, it's a challenge to go in the first place. But if people are like, "Well, where are you
True.
going? Why do you need a car for a day?" And so
Yeah.
so I think even though we have these um, physical barriers that are going to be part of how some people are living based on where they live
Hmm.
and their economic status in terms of what they can afford,
Yeah.
in terms of one car or many. But no matter how many cars you might have, there still is that stigma about where you're going, and people don't want to have their truck spotted in front of a
Right.
clinician's office because
Right.
it people
Right.
the
Right.
good thing and the bad thing about being in a small community is everyone knows you, everyone knows what you're doing, and
They do.
it's can be nice because people care, but also it's tough to have anything that's you want to keep to yourself
Yeah.
without having it get out as common knowledge. So
Yeah.
yeah, I think it's just
And,
it's
and I want to talk in a few minutes, Chuck, about maybe toolkits or resources that'll be available for communities to be able to break some of that
yeah.
stigma. But before we do that, let me ask you a question. You gave a very alarming statistic about suicide rates in rural compared to urban. I did not realize the incident rate was so high as a comparison in rural. Let's talk a little bit about that. Why do you find that percentage higher in rural? What would be your estimation of why that is? And as we look at that, obviously, as you see that higher need for services, um, what factors contribute to that mental health in those rural
Mhm.
areas?
Well, it is a culmination of all of these barriers because it does preclude people from being uh, diagnosed or having, even if they're concerned on their own and they want to pursue healthcare, it's typically it's further away, and it's, like I mentioned, harder to get an appointment. And the primary care physician is often the person that is diagnosing and treating someone in a rural community, or possibly it's ER, because of like physical ailments, people in rural communities often don't they'll avoid going to the doctor, and so it's for the variety of reasons we've talked about, not being wanting to be away from their job or their farm or their family, or not having access to doing that.
Hmm.
So it
Yeah.
really is. I don't know if there's just one thing that would lead to that, but the other shocking
Yeah.
statistic is based on the latest information from the CDC. Youth overall that are at high risk, but youth who are from 15 to 19 years old in rural communities are 74% more likely to die by suicide than their counterparts in urban areas.
Wow.
So that's shocking. And I'm not as if the other
Hmm.
stat wasn't bad enough, but in response to these statistics, we're developing programs that are they're specific to the segments of the population. So we're just working now on finalizing the pilot program for a rural youth mental wellness program, which we'll be launching in September, and we're very excited about that. It's specific to what we've learned, and again, back to us not creating something with the assumption that we know what people want. The rural youth program was formed from a advisory committee of rural teens and young adults, that 15 people from Future Farmers of America, 4-H, the National Grange, Cornell, and of course Rural Minds. But we had an ongoing dialogue, and we kicked it off with a hybrid presentation and meeting where we really kind of just uh, provided some examples of what's already out there, and then drilled down into why aren't these working? Why are these not aligned with how you want your information and what you're
Hmm.
looking for? And develop the
Yeah.
program around that input. So it was many months, about almost a year, to develop the program. And now it's in the pilot stage with some additional input from a few folks who are in the advisory team and their communities. But we're really looking forward to finalizing the content and launching that in September.
That's incredible. And we'll drop something in the show notes to advise our listeners about how they can gain access to information regarding that, because I think that's important. Let's shift gears a little bit and talk about, as we face all of the challenges with healthcare reimbursement, coverage issues, that presents a barrier to access at times, because where do I go? And right now, I would submit to you that we've identified some flaws in our system. Patients that come into the emergency department that may be, just simply sent back home because potentially there's no bed openings, and they are going to give them a self-evaluation tool, and essentially they put him on a safety plan, and then they send that patient home. And many times when I talk to professionals, I hear, it's their ability to refer to centers that have bed availability, and that they want to get the patient to the best spot possible, and the consumer to the best spots possible to be able to get resources to help them. And oftentimes those resources are limited in rural America. We have a 10-bed inpatient behavioral health unit, but most rural communities, if they had one, they're closing them right now because they're cost centers.
Yeah.
And insurance companies are certainly very difficult to work with. And in most cases with mental health, it's a mental health authority. It's governed by the state, and it's governed by local municipality, and some of their ideologies and philosophies can bleed over into how they treat that population. So I want to ask you, Chuck, you've been around the country. What are the flaws that you're seeing in the system right now that are preventing access to mental health services for our rural communities and the population that need them
hmm
most?
Well, across the board, the current healthcare models are more focused on reactive care rather than preventive care. And with the One Big Beautiful Bill Act, with the reduction of federal Medicaid spending by $1 trillion over a decade, it's got major impacts on patient
Yes,
eligibility,
it does.
state budgets, hospital funding. And in rural America, the Medicaid cuts severely threaten local health infrastructure. It's pushing already financially fragile hospitals toward closure, and
Yes.
nearly one third of all rural hospitals are currently considered to be financially vulnerable. So there's a significant
Correct.
number that are facing immediate threats of the closure. And because the rural hospitals are typically among the largest employers in rural towns and communities, a closure really does trigger a deep local economic situation as far as distress potentially. And then also the expiration of the Affordable Care Act's enhanced premium tax credits have
Yes.
ended, leading this severe health insurance premiums hike across the country. So rural residents are disproportionately affected, and the premium increasing beyond what many lower income people can afford to pay, which leads
Hmm.
to
Hmm.
more people without insurance. And just to share a stat from the American Hospital Association, they project that rural states will experience an average 30% decrease in marketplace coverage and a 37% increase in uninsured populations, which is
Yes.
devastating.
We're already seeing it
I'm
here.
sorry
We're
to hear
already
that.
seeing it.
Yeah, that's tough. That's really tough.
Yeah. It's very tough, and it presents another significant problem because as the tax credits fall aside
Yeah,
and as the average commercial rate and the Medicaid payments reduce, in rural communities, we find their heavy Medicaid population, obviously, because they're poorer, and the coverage goes away. They get, uncompensated care is what we get paid for. So we provide the care in the emergency department, but that's not the best place to get healthcare services, especially as it relates to mental health
yeah.
services. You wait there for a caseworker to come in, maybe 7 or 8 hours later, and then they arrive. So, fully agree with you that the impact of the HR one, I won't call it a beautiful bill, HR one has been and will continue to be very devastating for rural communities in all areas of aspect, but specifically mental health services, because as these hospitals are closing their behavioral health units, that is the first community benefit need that I can identify outside of obstetrics that we need to provide to our local community. Once medicated and once in group therapy, integrate fully back into society, and that's very important. But I want to ask you this question: are you seeing around the country? We have a ambulance shortage issue right now in our community. Are you seeing that patients are boarded in the ER more frequently and longer periods of time? Are you seeing that across the country? I know that's not part of our dialogue today, but I'm really most interested to hear your perspective on, are we getting patients out to the places they need to go?
Well, as far as in the ER department, I really can't speak to that, and I don't have any stats as far as what might be the situation across the country. I do know that you know obviously people do go to the ER for mental health, but it is a small
Yes,
percentage overall, from what I
it
understand.
is. It
And
is.
but I don't know the stats as far as how they might
Sure.
be, as far as number of beds
Sure.
or that type of
Absolutely.
thing.
Yeah.
Yeah,
Yeah, no worries. It's something that we're monitoring here is just getting the patient to the proper place where they can receive the best care
yeah,
possible, and especially, what we find, and it's a challenge across the country, pediatric behavioral health services. That population. You talk about a population that's overlooked in rural America. It's tough for adult population, but pediatric is so much more
yeah.
difficult.
I can imagine.
Placement is 200 miles away for me
Wow.
for any type of services.
Yeah,
It's just
that's
incredible,
unreachable.
and yeah. So Chuck, let's say this: executive is listening, which many do, and we often hear from hospitals across the country that have similar problems, and so that's why we have the podcast to bring them awareness and education. But let's talk about
Mhm.
resources, right? So, what's available from your organization to the CEO who says, "Yeah, Chuck, good job. You've just described my community. Now, what do I do about
Mhm.
it?" What resources are available?
Well, before I talk about the resources of Real Minds, because we're pretty much front facing with helping everybody, but I can
Sure,
share some thoughts on as far as uh, how hospitals and healthcare professionals might better support. Um,
please.
because there are several things that come to mind. So the hospitals and healthcare professionals really could better support rural mental health by integrating behavioral health more into the primary care clinics, expanding telehealth services, training community peers to reduce the cultural stigma. Because we know that people in rural communities want to get their information from somebody they know and trust. So if there's someone in their community that can be trained to help recognize people struggling and point people to the right resources, which does lead us to rural minds. Those are helpful. And since rural populations often heavily rely on primary care, providing mental health screenings, more of them with more
Hmm.
licensed mental health counselors and clinics that serve rural areas would really make mental health diagnosis and potential treatment kind of more standard. I know that is done in some clinics, but the more the better. If that could be more prevalent, that would be
Yeah.
really helpful. And then just not much we can necessarily do about the expansion of broadband, but when there's an opportunity to raise our voice for as far as from a legislative standpoint on expanding broadband, freeing up some funding that's been earmarked for that, and relaxing the telehealth policies that allow
Hmm.
specialists to treat patients across state lines, those who can't travel long distances, that type of thing. But because there's this distance as a primary barrier to accessing physical healthcare, mental health care. Mobile units, of course, are helpful, but that's that those are
They are.
expensive, and we recognize that they can
They
only
are.
serve a limited number of people. But
Yeah.
the resources that we provide at Real Minds, they're all free. They are all accessible online, and we recognize that since not everyone has access to the internet, much of what we have to offer is in a PDF, so that can be printed easily and
Good. Good.
distributed to other people. But the kind of the model that we use to develop the programs, I mentioned one example with the rural youth program, with having the content and the platform, the strategy, the distribution based on what we understand is needed in this case with youth. We do the same thing with other programs and working with other organizations. We're all about partnerships, so we have partnerships with national organizations that have a footprint in rural communities, such as the National Grange,
Good.
the American Soybean Association, National Association of Wheat Growers, um, several others. But the point is that we don't pretend to know what's needed. So we need to listen and have the ears on the ground for people that in those communities to help inform what the gaps are. And once we
Hmm.
develop something, we run it by these people to make sure it is culturally relevant. I mean, not that one size fits all, because another misnomer is that rural America is pretty much it's not homogeneous, it's anything but. There are all these different pockets of populations, and we tend to have a common vision of
Yeah.
the red barn and idyllic rolling hills around it, and that's
Sure.
part of it. But it's much more than that. So I think making sure that it's culturally relevant for the people that we want to reach. And then once the program is complete, it's on our webpage, it's accessible, it's free, but it's really not helping anybody unless people are accessing that. So we then
Correct.
allow again the on rely again on the people who have helped to create this with us in partnership to pull the information down, use it, distribute it, do presentations, talk about it, and we're we never intended for this organization to be about us. It's us listening to what's needed, providing the information, and then empowering people with the tools, with the information, with the resources, so they can, be the solution for making things better
Hmm.
in their local
Hmm.
community. And we even know from early on when we launched the organization, we had poll results from 1,000 rural voters, and like I think it was 78% of people wanted more information, free information about mental health resources, and even
Well, that's great.
acknowledge the fact they need something for youth and rural communities. So we know there's a need for this, and we also recognize the stigma. So we're trying to do what we can to understand how we can best um, create this content and make it
Hmm.
relevant and accessible, so people can use it to really empower others in their community to be part of the solution to improving mental health in rural areas.
Yeah. Great work. Great mission work. I want to ask two separate questions before I get to the closing today. First, as you weigh all of the things going on in this country as it relates to healthcare, we talked about HR 1, the big beautiful bill. We talk about limited access. I want to know from your perspective. You've been in this aggressively for 5 years, right in the middle of it. What keeps you up at night? when you think about the environment that we're in? What's got you concerned? Talk to me about that.
Yeah. Well, I really think that, as I mentioned, rural America is not uh, all about one industry, but the fact is that our agriculture industry and the farmers and ranchers that are um, responsible for making that industry successful are in rural America, and much of what they do does have a major impact on other areas in the community and other businesses and that type of thing. So the point is, I think when we look at the critical role that a very small percentage of our population plays, and this is specific to farmers and ranchers and agricultural workers, we are really relying on, I think it's like 2% of the population, feeds
Hmm.
the country and parts of the world. And the, um, and I find myself guilty of this too. I'll go to the grocery store and I'll fill up my cart with, nicely packaged fresh meat, poultry, and fresh
Oh
vegetables
yeah.
and fruits and that type of thing. And even the packaged materials that we get, we don't stop to think that all of this is coming from farmers and ranchers and
True.
agriculture workers who plant,
Rural.
raise, harvest, slaughter, package, and ship all this
Hmm.
to us so we can have it at a grocery store or order it off of a menu in a restaurant. And
Right.
the mental health, the physical health of everybody in rural communities is important. And but specific to our food security, we should be elevating the importance of what people are doing and giving more resources, more insurance, more financial stability to these groups of people. And it's the opposite's happening. So that's what keeps me up at
Yeah.
night. We're doing what we can
Yeah.
to help make a difference. We can't do everything. We can do something. So we're doing what we can do. But this is really requires
Yeah.
a national movement and
It
legislation
does.
to turn things in the direction of helping the
Yeah.
farmers and the ranchers and the people who are and doing all the work that a lot of other people don't want to be doing and aren't able to do. So it's an important recognition for us all to have and to not just recognize it,
It
but to
is.
do something about it.
Yeah. Sobering in nature to think about it. To your statistic, 2%, are feeding and packaging, what we see in that grocery store. And this is primarily being done in rural America where there are these barriers and deserts
Exactly.
to care. And so that's something that we need to be mindful of it's a great analogy. I've never even thought of it when I go to the store and pick that packet up, what was on the other end of it. It's a great perspective. Well, let's end positive. What one thing has you excited right now as you work in this environment? And are you looking forward to a specific program at your organization? Are you looking at something nationally that like, what, this is it's hope, it's an opportunity, and share with us a little bit about what that is.
Well, I really am excited about the launch of I mean, the work that we're doing overall is really gratifying. And I know that we are making a difference. And again, it's not about us, and we're not going to know the people that we help because a lot of people are, um, you know, getting the
True.
information
True.
and it's
Right.
helping and it's a good thing. They're able to continue doing
Yeah.
what they're doing and hopefully help other people. But the our future, of course, is youth, no matter if it's in a rural community or any part of the country or the world. So it's so important to be able to provide youth with what they need in order to succeed and provide for the future. And I think that we often hear about somebody who's has major challenges on a physical basis as far as going through life, and but yet they're very um, hopeful. They're very vibrant, and they're contributing, and they're doing in purposeful work and doing the best they can with what they have.
Hmm.
And on the flip side, we see people that are seemingly have everything going for them, and they're dying by suicide. So to me personally, that really helps me understand and recognize the importance of mental health as being the foundation for overall health. And the fact that we're doing this work specific to focusing on the challenges that rural youth have is I think it's very gratifying. It's very empowering as far as giving the information to the people who need it and letting them run with it. So I
Hmm.
think that
Yeah.
we are doing what we can to help set up a situation where we'll we will decrease the stigma that surrounds mental illness, and that's such a
Yeah.
huge initiative, and it's really a critical first step because well, it's already happening, but it's critical that it happens on a larger
Hmm.
scale because like any
Yeah.
other problem, we have to name it. We have to talk about what the problem
Sure.
is and
Yeah.
how to go about solving it or reducing it. And if no one can talk about or not enough people are talking about mental illness, especially in rural communities, that's a huge challenge. And I think that's one of the things that I'm most hopeful about because I think younger people are more comfortable about talking about mental illness, mental health.
I agree.
Back in the day,
Yeah.
cancer was known as the C word, and hopefully we'll get to that point where
Yeah.
we are talking about mental
Correct.
health like we talk freely about cancer these days, as we
Yeah.
should.
That's right. As we
Yeah.
should. Absolutely. As we should. Well, great perspective. Great work that you're doing. We're going to drop in the show notes how to access resources, how to get an audience with your team, what is available to the rural CEO that's listening today saying we need to build a partnership.
Hmm.
All of that's going to be made available to our listener today. And before we close, we always like to do a segment called Rural Health Recommendations. And it's, as young leaders are listening to this podcast, I get the emails that say, how do we do this? And how should we handle that? And what about this? And we thought, what would be great? Take our experts like you on this program and just get a tip from them that we then promote to our
Hmm.
listeners. So this is called Rural Health Recommendations. From your experience and vast amount of experience, I'm going to ask you, give us some sage advice for the new leader today that's rising up in healthcare, saying, there's some challenging times. How do we keep our hospital open? 734 are slated to close in this country as a result of HR1 and other mitigating factors such as healthcare inflation, rising costs. We just had a hospital announce yesterday closure tomorrow. They're closing 45 miles from here. The hospital's closing altogether, 3 days' notice. We're hearing more and more of those stories. Over 150 hospitals have closed in this country since 2010, all of them rural. It's why we launched the podcast, was for that specific reason, to tell our communities across this country that we have to advocate for rural. With that, for the young CEO, maybe it's not the young CEO, maybe it's just a new leader who's been in an organization but just promoted to a leadership role. What sage advice would you give them? What advice, what wisdom for them to keep on keeping on in this very tumultuous environment?
I would say that doing the work that is being done in this space, it's all about wanting to be there to help other people, to provide opportunities and resources for people to get the health care they need, whether it's physical, mental, whatever it might be. And with that said, it's too much is not enough. So I think it's so important to focus on self care in addition to caring for other people. And
Mm-hmm.
to back to the stigma, don't just because you might be a healthcare leader, it's okay. You're human. It's okay to say that you
Yeah.
are having a physical an emotional mental health issue. So don't be part of the stigma. I mean, talk openly about it, bring it into everyday conversations. And if you have a personal story to share, like our founder, Jeff Winton, he talks openly and freely about his tragic personal story. Not everybody can do that, but to the extent that you have the ability to share what you feel comfortable or even maybe a little bit uncomfortable about, if it's going to make a difference and help
Mm-hmm.
you help somebody else, put it out there.
Yeah.
And also, it's important for us all to check on family members, check on friends, to see how they're really doing, not just how's it going, but really kind of pay
Yeah.
attention. And if you're concerned that
Yeah.
somebody's struggling, um, be brave and ask them about it. And even to the point of
Mm-hmm.
asking, are you thinking of harming yourself? And one
Yeah.
thing I want to mention too is it's the three-digit code 988 has been around for a couple of years, but it's truly amazing how many people are still not aware of it. So I want to mention that 988 is a national three-digit dialing code for the suicide and crisis lifeline in the U.S. And by dialing 988, you're connected to free, confidential 24/7 support for anyone that's experiencing emotional distress and or a mental health crisis or suicide thoughts. But you don't need to be in a suicidal state to call 988. It's fine just to call,
Hmm.
ask a question that maybe it could help you, maybe it could help someone you care about. But it's an amazing resource. And again, for mental health information and resources that are free of charge, culturally relevant for rural, just visit ruralminds.org.
Excellent. Thank you so much. I think the theme of this podcast over the past several months, and you said it, has been the charge to our listeners to tell your story. And I think that's so important. Tell the stories.
Mhm.
Tell the stories. Let it be known. Don't do this in a silo. There are resources available, whether it's from Rural Minds or your local CMH partnerships, whatever it is. Find a partner, but tell your story. I think that's so incredible. So, Chuck Strand, Executive Director, Rural Minds. It's been great to have you on the podcast. I look forward to getting you back here in a year and talk about how the initiative has gone for your youth
That'd be
initiative.
awesome.
Would you be willing to do
Thank
that?
you, JJ. I
Yeah.
love that. Yes.
Let's do that. So we'll get that booked up for you. So it's been great to have you on this podcast. Thank you so much for joining us. And thank you to our listeners for tuning into Rural Health Today. Catch our next segment, Rural Health News, to stay up to date on the current state of rural health care every Monday, wherever you get your podcast. And don't forget to check out the latest updates and resources from Rural Health Today at ruralhealthtoday.com. And make sure you subscribe to the show so you never miss an episode. Until next time, remember, rural health strong.